I want you guys to notice that there are 4 other dates. This is a series that's actually being put on by our state health professional or clinicians for climate action groups. One from Wisconsin, that's who's hosting it today. There's the Michigan group, the Illinois group, the Minnesota group, and the Ohio group. And if we look here, we can see what dates they are doing their presentations. All of them are on Tuesdays. I think it's the 3rd Tuesday of the month. It starts at 6 o'clock Central and 7 o'clock Eastern. And in February, we hear the Minnesota group is hosting it, and they're going to be talking about the threats of pipelines cutting across the Great Lakes. And then on March 23rd, we'll hear from, it'll be the Ohio group that's going to be hosting, and that's Farm Without Harm, Agricultural Climate Impacts and Solutions. Then in April, it's a Michigan group that will be hosting Sustainable and Resilient Healthcare in the Midwest. And then in May, it will be the Social Determinants of Health, and that'll be the Illinois group that's hosting it. So here's our overall agenda. I assume Jonathan is back. Is that correct, Abby? That's great, since I can't see everybody. We have the good fortune of having Dr. Jonathan Patz here, who I will introduce in a few minutes. He is going to do an overview of climate change and health impacts. And then we have a group of additional practitioners, Karin Zuegge, Brandon Kim, and Alister Martin, which we'll introduce as we get ready to ask them some questions. We'll have a few questions that'll come from our moderator, Abby Lewis, and then we will take some questions from the audience. At the end, we're going to break out according to our states into smaller groups so we can kind of get together some ideas about what our next steps will be. So I'm going to stop sharing here, and I'm going to introduce Dr. Patz, but I want to get my notes up in front of me. Dr. Patz is an internationally known leader in climate and health. For 15 years, Dr. Patz served as a lead author in the United Nations Intergovernmental Panel on Climate Change, or the IPCC that we refer to so often. He was actually one of the recipients of the 2007 Nobel Peace Prize, and he's the director of the Global Health Institute and a professor at the University of Wisconsin in Madison. And we are so lucky to have him here. Dr. Patz?
Thank you, Lisa. It's an honor to be presenting to the group. Looks like a nice sized group tonight, and I see lots of colleagues from Wisconsin Health Professionals for Climate Action, and even some ski team friends. So I'm going to just do a very quick overview of climate change and why it matters to health, and where there are some huge benefits to climate action, and bring it home to the Great Lakes region. So just a quick 15 minutes of this, and then we'll get into the more exciting panelists. I'm just giving you the overview. I'm the warm-up act. So I'm going to just share my screen here. Okay, so Abby, I assume that looks good? Okay, so let's dive into climate change, which of course we're calling the climate crisis because we know it's a crisis, and words matter, as we know. So the climate crisis, health in the Great Lakes region. And I'm going to be quick here because most of you know these things already, that the main physical attributes of climate change: rising temperatures, sea level rise, extremes of the water cycle. And there are so many pathways through which climate affects our health. And this is sort of a general list in the green box, various pathways that lead to all these different climate sensitive diseases. And I'll just show a couple examples. So heat waves, we know that people die in heat waves. And this is some work from our climate research center here in Wisconsin at the university, showing that a city like Milwaukee will see a tripling in the number of hot days, days that are greater than 90 degrees, just in a few decades, going from 9 days that are 90 degrees or hotter to 25 days. And this is projections from the Wisconsin Initiative on Climate Change Impacts, or WICI. You can see the forecasts from across the state looking at warmer temperatures, and extreme heat kills more people than all other weather disasters combined. So we know that heat waves are a threat. The other thing with warming temperatures, it affects ragweed pollen season. So if you have children with asthma, notice that in Wisconsin, our ragweed pollen season is 13 days longer than it used to be. And that's because there's more CO2 in the atmosphere, and Wisconsin has warmed 1 degree Fahrenheit since the 1950s. So this is something that certainly we are concerned about when we think about risk, and higher latitudes are more affected in this modeling. Now, aside from heat waves and asthma, the other side of the water cycle, rather than droughts and heat waves, is flooding. And we know that we are at risk in the Midwest, in the upper Midwest and the Great Lakes region. Flooding is a big concern, and we saw a lot of this happen in Wisconsin. And now you can see annual precipitation has increased, and there are a number of health impacts. I won't go through all of these, just a list of health impacts. We've looked at infectious disease risk from poor water quality. We did some modeling studies knowing that the forecast is for very heavy rainfall events. So not necessarily will it rain more or less in a location, but when it rains, what will the rain look like? And because hot air holds more moisture, when it rains, it can really pour. So the idea of extremes in rainfall. So we modeled the water basins that feed into the Chicago water system, and we found that by mid-century, we could see heavy rainfall events, so much so that the risk for the sewage systems would increase. I don't know if you've heard of combined sewage overflow events, CSO events, when it rains so hard that the systems can't handle the sewage and the stormwater runoff because it's just too much. And many communities still combine their sewage and the rainfall runoff because it's extremely expensive to separate them, although we're trying, and many cities do separate them. But enough, there are these enough combined systems that this is a real threat to the quality of water. Another area of concern, climate sensitive diseases carried by insects. And the difference between that mosquito and us sitting in front of these computer screens is that we are warm-blooded mammals and our body temperature is always the same. That mosquito and that species happens to carry yellow fever, dengue fever, and Zika virus. That mosquito's body temperature is the same temperature as the air surrounding it. So tiny changes in temperature can have a huge influence on the transmission dynamics of these diseases. And their West Nile virus, carried by a different mosquito, has some climate sensitivities. Zika virus is absolutely temperature dependent, as is dengue. So these are diseases that may start coming up into our region. Well, that's pretty scary stuff. That's sort of the scary part of climate change is truly a health emergency. But we worry, I saw this op-ed, and all that we've had to do to shut down the global economy to solve the COVID pandemic, until the vaccine is really distributed, there's been a lot of suffering around the world. And will people even be able to handle the threat of climate change? Will they be able to handle, the risk, the sacrifice to solve yet another global crisis? But unlike COVID-19, personally, I think combating climate change offers a lot more. It could be free. It could be a net benefit when we think about health. And I've been talking about this for the last few years about the challenges and opportunities when you think about, the climate change risks and the opportunities from climate change action. Solving the climate crisis, the greatest health opportunity of our times. A low carbon future could improve global health and achieve economic benefits. And the main sectors we've looked at are in energy, and air pollution kills 7 million people prematurely every year. The food sector, by having a high meat, high dairy diet, very energy intensive, but also not good for our cardiovascular systems, that if we could get to the universal healthy reference diet, which is much less meat and dairy, and what we know, fruits, vegetables, a little bit of fish, those types of things, we could save 11 million people every year. So that's huge. And finally, the transportation sector, by having over reliance on motor vehicles, there's now, we have an inactive population. Sedentary lifestyle is leading to 5 million deaths every year. So big opportunities across those sectors. With COVID, there was a study out of Harvard that looked at the air pollution over the last 15 years. Top map is air pollution. The bottom map is death from COVID. And these epidemiologists from Harvard found that just a tiny increase, 1 microgram per cubic meter of air, increase in fine particles, PM2.5, was associated with an 8% increase in the risk of dying from COVID. So an immediate benefit from reduced air pollution. And with COVID, we have had to shut down the global economy, much of it based on fossil fuel combustion. And look at this image of nitrogen dioxides by satellite over France and parts of Europe last March compared to this March. Same thing, nitrogen dioxide last March in the United States, and look how much cleaner it is when you shut down fossil fuel combustion. And who would ever have imagined these mega cities in India having clean air quality index? Just unbelievable. I mean, this says it all, this image. Just so clear, New Delhi, India, before shutting down fossil fuel around the world and after. Nothing's more clear than this, comparing these images of air quality and recognizing how many millions die from air pollution. So at this time, do we really want to uncork the current fossil fuel economy or get to a clean energy economy where everyone prospers and really build back better, like the UN is talking about, like the Biden administration is talking about? This is just one example, of deaths from air pollution, from coal-fired power plants. If we swapped out coal-fired power plants for solar, that would save 52,000 lives per year, according to this study. In Wisconsin, we took advantage of a clean energy scenario run by a recent graduate student, David Abel and Katja Spear. And this is this energy scenario, a very clean energy scenario for the state of Wisconsin. Look what happens if we follow that scenario. In addition to the number of jobs, 162,000 extra jobs created in renewable energy, we would save lives and we'd save all these other problems. So huge benefits. And this equates to reduced PM 2.5 and ozone that would equate to $21 billion annually saved. And they're the extra jobs, net jobs for clean energy. Another sector, I think this is the last one, just opportunity to getting to sustainable transportation. Maggie Grabo, one of my students, led this study. The headline was "Swapping Tailpipes for Pedals, Small Changes Could Pay Huge Dividends for Public Health." We'd save 1,300 lives annually in the upper Midwest across the largest cities. And this is by taking the short car trips, less than 2.5 miles in urban centers, and having half of them turn into bike trips, and only in the summertime. So 4 months a year, half the short car trips into bike trips, and look at the benefit. So I'll end by saying that people are recognizing that climate change absolutely is a health emergency. We have Dr. Rubley on here, I can see, and we've got the ER doctors are in the lead amongst other doctors. But this is a health emergency, and these are key groups, the Medical Society Consortium on Climate and Health. That is what the Wisconsin Health Professionals for Climate Action, we are part of that national group, as are these other state groups that Abby mentioned. And there are some international groups. And so, and then green hospitals, healthcare without harm, green hospitals. Karin Zuegge is going to be talking. She's an expert in that. And these groups have sent recommendations into the administration. So I'll wrap up by this this image I saw in an op-ed, and I just love the image. I mean, it's scary, but it's, why don't we treat climate change like we're treating this pandemic? Because after all, climate change is a global health crisis. So with that, I just flag the report that the Wisconsin Health Professionals for Climate Action and the University of Wisconsin-Madison put out recently, modeled after the other reports of the consortium of the Medical Society Consortium on Climate Change. So with that, I thank you for your attention. You can follow me on Twitter. And now to get to our panelists, and I'm going to rely on you, Abby, to help introduce everyone and handle the questions coming in. Thank you.
Yes, thank you so much, Jonathan, for that lovely presentation. It really highlights that not only do we have some health challenges and health harms that'll come from a warming climate, but we also have a lot of opportunities when we take climate action. So it's important to think about some of those positive things that can come along with hard work as well. It is now my pleasure to announce some of our panelists for tonight. I'm really honored that a lot of them are able to join us because we have a nice mix of health professionals from various places in their career who've all become advocates in different arenas of really working on climate and health. And so our first panelist tonight is Lisa Del Buono. Dr. Del Buono is recently retired diagnostic pathologist who came to climate advocacy as a concerned parent. She has volunteered with Citizens Climate Lobby since 2013, and she became the co-lead of CCL's National Climate and Action Team and is the state liaison coordinator. As such, she supervised quarterly lobby meetings with the entire Michigan House and Senate delegation, as well as occasional briefings and other events. Last spring, she founded the Michigan Clinicians for Climate Action, and she's now their executive director. Our second panelist tonight, Karin Zuegge, is a general and ambulatory anesthesiologist and vice chair for education in the Department of Anesthesiology. Karin is also a member of the American Society of Anesthesiologists Environmental Task Force. She joined the University of Wisconsin Department of Anesthesiology in 2011 and formed a perioperative green team in 2012. She tracked the cost savings from encouraging environmental friendly practices and used them to propose funding for her own novel role. She is now the first ever medical director of sustainability at UW Health. Next, we have Brandon Kim. Brandon is a fourth-year medical student and Masters of Public Health student at UW-Madison School of Public Medicine and Public Health. Interested in upstream determinants of health, he looks forward to a future career in family medicine and incorporating climate advocacy wherever he goes. And lastly, we have Alister Martin. Alister is a practicing emergency physician and served as the former health policy aide to Governor Peter Shumlin of Vermont and Congressman Raul Ruiz of California. As faculty at Harvard Medical School in the Center for Social Justice and Health Equity, Alister works at the intersection of public policy and hands-on patient experience. He leverages his background in politics, healthcare policy, and the field of behavioral economics to use the ER as a place to build programs that serve the needs of vulnerable patients that frequent it. Most recently, he launched Vote ER with a team of physicians, policy, and behavioral science experts. We will start with a question for Brandon tonight. As a student working in this field, what is your vision for how the field of medicine might change within your career in respect to climate advocacy and awareness?
Yeah, thanks for having me on here, everyone. Yeah, so I think that I think climate is becoming something that's more and more common to talk about. And I hope that it continues to be that way going into my future. I hope it's something that we can talk about more in our clinics, to our patients, and in our communities as well. I think it's important to make it a little bit more commonplace to talk about these things, especially both the health and environmental benefits. Kind of as Dr. Patz was saying, thinking about how working on clean energy can improve health in our environment, moving towards a vegetarian diet, creating infrastructure to allow for more active transportation, those sorts of things. I think those sorts of things are really important to talk to our patients because they're so widely beneficial in so many different areas. And I think it's also important to think about how we're going to deliver healthcare sustainably. And I think I mean that not just environmentally sustainable, but I think kind of in all areas, making sure that it's sustainable for our health professionals, sustainable to our environment, sustainable for our patients as well to understand and work through the system.
Thank you so much for sharing that wonderful answer. Alister, your Vote ER program revolves around bringing advocacy into the clinic. How can health professionals bring advocacy into patient interactions? Do you have any advice for health professionals looking to become advocates?
It's a great question, Abby. Thank you. And thank you all for putting on this exceptional session. And thank you for coming. I think the world would be a lot better of a place if physicians and nurses and PTs and OTs and healthcare providers got more engaged like you all are today. So thank you for being here. I think a lot about the Toni Morrison quote, which she said, remember that when you get those jobs that you're so brilliantly trained for, remember that your real job is that if you have power, to empower somebody else. And I think that's our calling. We are only one individual as practitioners, and there's only so much we can do. But what if every patient that we talk to, we brought in a piece of ourselves that we think of as an incredibly important piece, which is our advocacy and our ability to advocate, not just in the exam room, but in the places where decisions are made on healthcare policy. And so the way that we do that with Vote ER, there's lots of different ways you can bring in advocacy to your conversations with patients. But let me show you one. This is what I wear to work every single day. This is my badge. So when I go to work to the ER in 2 days, I'll wear this. This is a lanyard that patients often comment on. They ask, hey, doc, why does your lanyard say vote on it? And I'll say, well, it says vote on it because if you're interested, I want you to take 30 seconds right now. And I want to make sure that you can register to vote. I want to make sure that you check your registration because some of these states, I'm not pointing any fingers, some of these states, all of a sudden, you're off the rolls. Or like in 2020, you know, when it was really important for folks to vote at home, we would say, hey, look, make sure that you take 45 seconds and get your mail-in ballot. So you can weave this in various ways, but this is one of the ways that we advocate for. And I'll drop a link in the chat. These are free, by the way. We don't charge for these things, but that's one way.
Wonderful. I definitely love the Vote ER badges, and we had a lot of doctors and practitioners using them this year. Our next question is for Karin. Within your department, you managed to lower carbon emissions by over 70% from 2012 levels. How did you inspire such a large change? What advice would you give to others looking to influence similar shifts in their medical departments?
Thanks for asking that question. It came to me as a big surprise too, how much it was, and I didn't know until we measured it. Until you take a few steps and then you look back and you see, oh my gosh, we've done all these things, you won't know how far you've come. So I think there are two lessons in this. One is to start anywhere. It can be so overwhelming. You have this whole global problem, the climate is changing, the ocean levels are rising. Where do we even start? But pick any one thing and make some step, and then take another step and another step. And then after a little while, you recognize how far you've come. And every person you talk to, similar to Alister's, like every patient you meet, and anybody who you can help register to vote, or anybody who you can say, you know, hey, did you know there's a bus stop over there that you can use instead of, you know, paying so much for parking? Any little thing you do accumulates over time. And this just started with me giving a grand rounds lecture and saying, let's maybe label some things in the operating room to show people if you choose this drug, it has this impact. And if you choose this drug, it has a different impact. And they're like Coke and Pepsi. They're really like the same thing. So maybe you could choose the greener option. So advocating for this, encouraging people. And then after we did that, a pharmaceutical company representative came to my practice and was looking for me and said, oh, did you know, our product is so great, and how come you're advocating for people not using it? And then I realized, wow, that must be costing them a lot of money if they sent someone to find me. And then we started to, I thought I should really measure this after the project had gone on for a couple of years, and it astounded us to find out how much of a difference we had made just with a few simple steps. It's really impressive. So don't be discouraged. Try something, and anything you do is really positive and can accumulate amazingly over time.
It is incredibly amazing, and I think it's really inspirational when you acknowledge the fact that you didn't even know it was that high of a level until it was measured. So thank you for all your hard work on that. Our next question is for Lisa. Last week, we saw a transition to new presidential leadership. What type of policy opportunities do you see for climate and health in this new political environment? What regulatory and legislative options are possible under the new administration?
Well, thanks again to everybody being here. I feel humbled to be part of this panel, and that's a great question, Abby. It's no secret that the Trump administration was no friend to the climate crisis. That's an understatement. And so it's very encouraging to see President Biden rejoin the Paris Agreement on day one. But if we want to stay under 1.5 degrees C, we're going to have to do much, much more to reduce emissions quickly. So I'm going to draw a little bit on my experience with CCL and carbon pricing and point out that it's imperative that the president, first and foremost, restore EPA's powers to regulate. But I hope he also encourages Congress to pass a multifaceted legislative package that, as Dr. Patz said, allows us to build back from COVID by attacking the issue from a variety of different angles. For example, the package should include an incentive that emphasizes electrifying the building, manufacturing, transportation sectors, improves overall energy efficiency, makes it easier and safer to get to work by active transportation, promotes carbon sequestration so through regenerative farming. But of course, the thing I think that can amplify all the rest is to charge fossil fuel companies a fee on greenhouse gases based on the emissions that coal, oil, or natural gas produces. You know, there's no silver bullet, and as health professionals, we understand how important it is to protect the Clean Air Act and EPA regulations. But we also need to remember that many experts, including the new Secretary of Treasury, Janet Yellen, all agree, and I'm quoting here, that the most effective mechanism to reduce emissions at the speed and scale necessary to meet IPCC goals is to place a price on carbon. But why is it effective? Ideally, a fee on carbon should be administered, in my opinion, as far upstream as possible, so it affects all sectors of the economy, and so it can amplify the emissions reductions realized by the many other regulatory and legislative efforts put together in that comprehensive package I just described. Now, we know that a price on carbon could hit low-income families really hard. And that's why, again, in my opinion, I support that it's a specific type of carbon price and specifically carbon fee and dividend, because by returning revenues generated by the fee, and that's a lot of money, directly back to US citizens, it offsets potential rising costs passed down from the fossil fuel companies. Most Americans will come out ahead because of the dividend, and it's only the very wealthy with very large footprints that would really take a hit. All carbon pricing, all types of carbon pricing are not the same. In contrast to cap and trade, a fee works well with complementary regulatory policies that protect the front line. The fee is easy to implement and it's transparent, and it's not burdened by a secondary market in which polluters offset their emissions in a game of whack-a-mole that has the potential to leave frontline communities exposed to localized health impacts of air pollution. It's really a pivotal time in our history, and although I'm really hopeful about the future, I think it's imperative that we come together as health professionals to support this comprehensive approach to the climate crisis, which includes targeted regulations and a multifaceted package of laws that has as a cornerstone a price on carbon that returns the fees back to US citizens.
Thank you, Lisa. Our next question is for Brandon. Health professional students are driving climate health initiatives around the country. What type of projects do you see medical and nursing students working on? And what can we do to support these students and their energy?
Yeah, this is kind of an exciting question, I think, for me. I think health professional students are so diverse. I mean, you're not just talking about medical students, you're talking about nursing students, PT, OT, you're talking about PA, NP. There's just a huge gamut of health professionals that we can be getting together. And I think that because it's so diverse, we all have different areas that we're interested in or thinking that we want to get involved in, whether that's more advocacy in communities or if it's more thinking into policy, law, or our governmental areas, or supporting local organizations. And I think that a lot of students are kind of dipping our toes into many different ponds, trying things out, and kind of learning how we see ourselves fitting into this sort of work in our careers. So I think that there's so many different areas, and it kind of depends on the individual and what they're willing to try out. And I think as far as like how to support students in their aim to get a part of a part of these sorts of projects, I think I'm kind of thinking of three things. I would say that first, that it's important to reach out to students, especially now we're virtual. And I think that for a little bit of time and maybe even further into that virtual meeting is going to be a thing that we're doing more and more, and people are more comfortable with that. So you can reach out to students across your state, across the country. It's something that our world's becoming a lot smaller. I'd say second, that if you are doing any sort of exciting, interesting, important work, that to try to include students. Even if we're just a fly on the wall, just listening in, I think it's such a great learning opportunity for us to kind of take in what it means to try to be an advocate. And I would say lastly, that it's important to understand that even if we may not be available to engage at a certain point of time, it doesn't necessarily mean that we're not interested. We're getting pulled in so many different directions. And it's often difficult to, balance all these things out. So sometimes it's might be hard to engage, but other times, it might be a better opportunity for us. So I think it's important to keep reaching out and keep involving our students.
Yeah, I think those are three great pieces of advice. And we also have a lot of students with us tonight. And another thing I've heard often from students is being integrated into the climate and health movement has also helped introduce them to new people and help them build their careers, help them get advice. So the benefits go both ways. All right, our next question tonight is for Alister. How does a healthy democracy fit into climate and health and other health advocacy issues?
That's another great question. I want to take a second to just bring this home for you all. I see a lot of folks from Michigan, so I was able to do a little bit of research and rather than using an example from Massachusetts or Boston, I want to show you your neighborhood. So I'm going to share my screen. This is Southwest Detroit. Some of you either practice there or have lived there. And Southwest Detroit has 24 industrial sites. You can see them here: oil storage plants, oil refineries, chemical plants, asphalt. The residents there live 7 years less than the United States as a whole. Okay. We heard earlier from Jonathan about the potential savings of ER visits and hospital admissions if Wisconsin, as the state that he mentioned, would move to a smarter energy policy. We'll take a look what the impacts are here in Southwest Michigan. Asthma hospitalizations are twice as high. Myocardial infarctions or heart attacks are 5 times as high. This is from an incredible article that we found before the session. COVID plus decades of pollution are a nasty combo for Detroit. Now, if I were to ask you, and we're not going to do the whole Zoom poll thing, but if I were to ask you, do you think Southwest Detroit has a higher voting rate or a lower voting rate than the rest of Detroit? What do you think the answer would be? Do you just give me a thumbs up if you think it's higher, or a thumbs down if you think it's lower? Okay. I got pretty broad thumbs down. I have a couple thumbs up though. Okay. So maybe there's an argument for why Southwest Detroit, which has much more pollution, has a higher voting rate. Maybe that exists, but I have never heard of that argument. For those of you who said it would be lower, you're right. The same places where folks are not registered to vote, the same places where folks are not turning out to vote, are the same places where folks are dying earlier, where they have asthma, where they have heart attacks, because of the environment and the pollution in the local. So listen, it starts with voting. This is how the political system has been set up. Can't change the rules quickly. We can over a long time, and hopefully through voting we can change the political system in a quicker way. But we got to make sure that not only ourselves, but the folks that we take care of are registered to vote and can make their voices heard.
Yes. I love the comparison with voting numbers and the health statistics. Thank you for sharing that, Alister. Really strong argument for why we need to bring a healthy democracy into our clinics. Karin, you got a question from the audience. Julie asked, how did you measure greenhouse gases in your healthcare system specifically? Did you use a third-party monitoring vendor?
No, we did not. So for the operating room specifically, there are known equivalencies for the anesthetic gases, and that's what this project mainly focused on. Also, that is one of the highest cost areas because pharmaceuticals are so expensive. So that was a really fascinating to see what an enormous economic impact this had, along with the decreased carbon footprint. So there are anesthesia gas carbon calculators that you can download for free from Yale, and also from the American Society of Anesthesiology. And then for many things, it's nice to go just straight to the EPA too. So when you look at one thing that I think is interesting too, because it's hard for people to wrap their head around, like, this is 4 million kilograms of carbon dioxide. You know, what does that mean? How is that, relevant to what I do? So you can go to the EPA and you can just Google EPA carbon equivalency calculator, and then you know from your gas or from your trash or whatever it is that you have for your energy that you use at your hospital, you can type in what is that in miles driven, or what is that in trees planted if you want to go the other direction. How many trees would you have to plant to recapture that carbon? And those sorts of statistics are really impactful for providers and individuals, because they're like, wow, I didn't know that's like what we saved in 1 year was like taking 800 cars off the road for a year. That was so interesting. Or for people to see even that little bit of gas that we use, people are like, how much is it? To say 4,000 trees planted as saplings and grown for 10 years. If you use this gas versus this gas. So that sort of thing is readily available and for free right on the EPA. We didn't use a third party. We're looking at right now getting a more comprehensive idea of what our carbon footprint is for just beyond. So my personal project was the operating room, but getting a more comprehensive handle on what our carbon footprint is at our health system, and then advocating for carbon neutral goals within our health system. And something that Brandon said too is engage students. So I found out that we have Shapiro projects at our university, and I've done my first submission for Shapiro students to do a summer project with me, and I got 2. So I'm really excited about that, and the funding exists, so that's really exciting.
Yeah, that is incredibly exciting. It's cool to see that there's free programs out there where you can measure some of these great successes. Lisa, our next question is for you. Even though there is widespread agreement in the medical and scientific community about the harms and reality of the climate crisis, we sometimes see politicians dispute climate facts and the need for action. How can health professionals respond to politicians that do not support climate and health initiatives? Why is being nonpartisan a critical approach to encouraging future policy? And how important is it that any legislation being passed is bipartisan?
Abby, these are excellent questions. And through my work with Citizens Climate Lobby, I've had a good fortune to do a significant amount of lobbying directly with members of Congress, including serving as a liaison to a conservative Republican with whom I've actually developed a pretty close relationship. I think health professionals can respond to politicians in much the same way as we would ideally respond to our patients, by listening with an open mind and a generous heart. I think many of us think that we're going to walk right into our legislator's office and, maybe one who falsely believes in false truths, and we'd explain the science to them, and they'll just go, oh my goodness, of course, now I understand. But, that isn't how change really happens. It's much, much more like working with a patient who struggles with an addiction, really. Just knowing the facts is not enough. What it requires is developing a close, trusting relationship. And that takes time. You have to meet with them over time. And many of the techniques that we've learned through motivational interviewing can actually be applied here, including reflective listening and open-ended questions that elicit a verbal response. So if your policymaker states out loud, why transitioning to clean forms of energy would actually be good for their constituents, if they verbalize that, especially if there's an audience around, she or he might be more likely to actually move in that direction. Lobbying is very much a process, but it's a process that we as health professionals are very comfortable You know, I'm sure most people know this by now, but we are among the most trusted professionals, especially nurses, but doctors and pharmacists right behind them. And we come with personal stories from our medical practices. And recounting those stories will have a much greater impact than reciting statistics. It brings to life the human face of the climate crisis. Now, finally, to address the issue of staying nonpartisan, you know, I have to admit that even though I've worked in the bipartisan space for quite some time now, I am really struggling with how I'll interact authentically and generously with legislators who have put our democracy at risk by validating false claims about the election. This is hard. But you know what? I'm going to find a way to work with these legislators because Congress is so equally divided right now. Significant legislation is not going to get passed without at least some members from both sides of the aisle. And we can't rely solely on executive actions or on regulations because they run the risk of being overturned by subsequent administrations or being challenged in an even more conservative court system. And all of that takes time, and we don't have time. So I really implore each of us to just find some way to work across the aisle despite our personal reservations because time is running out. I really think this is our last best chance to minimize the worst impacts of the crisis.
Yes, well said. We definitely do not have a lot of time to see some major change. For folks who do not have your chat window open, we are dropping any questions we might have for the panelists in the chat. So please feel free to put them in there if you have anything you'd like me to ask tonight. We have 10 minutes left with our wonderful panelists. Our next question is for Karin. As we push for climate action and resilience in the Great Lakes region, how can health systems and hospitals lead by example? Why should health systems see climate smart care as their responsibility? And how can health professionals become advocates for change within their systems?
So this has such an enormous impact on health, as Jonathan pointed out, that it really is, it's a no-brainer. It's a social responsibility and a commitment to social responsibility that most health systems have within themselves. What is harder to convince, so not the, most people in healthcare would say, I support this. However, really making the argument that this is good business practice for the long term is very important. Unlike other crises like the COVID crisis or a hurricane or a small time-limited sort of urgency, this is not going to be changing. This is something that this crisis isn't going to end in a couple weeks and just be transient. It's going to be something that's going to continue. So I think making clear to them that it's not just the right thing to do, but it's also good for business. This is why money needs to be invested in this, because of many of the things that Jonathan pointed out in his talk too, that the days missed of work, the visits to the ER, the days in the hospital, the access to pharmaceuticals for patients, all of these things are a cost and a burden to the state and to the system. And so making that clear to people is really important.
Awesome. Yeah, it's definitely can save on the bottom line. And I've also heard a lot of wonderful arguments that it can help with worker retention, especially as more students are moving into their professional careers. They have grown up in the crisis and are looking for the hospitals and clinics to really take that seriously and create action in their communities for change. Our next question is for Alister. Alister, is faculty in the Center for Social Justice and Health Equity. How has your work with vulnerable populations motivated or affected your advocacy? What is your philosophy regarding the place of equity and justice in community health?
I was at our computer terminal maybe about 6 or 7 months ago while we were rounding for the doctors who are on the call, the nurses on the call, you'll recognize the scene. You know, it was me, I was the attending, and there were, you know, two nurses flanking me, a medical student, my resident, and we were rounding, looking at the computer screen, and a patient had just come in. The patient was 21 or 22, very young, and had diabetes. And the chief complaint was DKA, diabetic ketoacidosis. This is a you know, disease, very, very rare complication of diabetes that you only really get when you don't take your insulin or you have some other sort of underlying cause. But typically it's from folks who don't take their insulin. And so one of the residents noted that, oh my God, this patient was just here 4 days ago for DKA. And, you know, we sort of engaged in the normal conversation of, oh my, how could this person not be taking care of themselves? I mean, geez, you know, just take the insulin. It's like, you know, two episodes of DKA in a week, that's unheard of. And I remember something not sitting with me well after that. And I remember she was someone who actually was going off to another pod. So I wasn't the doc seeing her, but I went and introduced myself. And I just, you know, just to, you know, first of all, check in on you, make sure you're okay. But I'm just curious what, you know, I just saw that you were here recently for the same thing for DK. It's very rare to get that. What's going on with your insulin? You know, have you been taking it? She said, it's not that I haven't been taking it. It's that I don't have any. She's been rationing her insulin. You see, because in Massachusetts, she had Mass Health, which is our Medicaid. And she luckily got a new job that paid her a little bit more. But she no longer qualified for Medicaid in the state. Couldn't pay for her insurance. Was paying for insulin out of pocket, $1,150. Okay. I remember walking away from that conversation and thinking, man, there is no procedure or surgery that I'm going to do for her. There's no prescription I'm going to write. I can't solve her problem with an intervention, but she can solve her problem with voting. We can solve her problem with voting, and by making sure that we all do so. So that to me it's these stories that drive me as an individual practitioner, and my work at the center is trying to figure out how do I take what I see on the ground and try and sort of go upstream and figure out how we can create interventions to solve those problems.
Wonderful answer. Our last question of the night is for Lisa. Can you tell us your motivation for founding the Michigan Clinicians for Climate Action? How has organizational power been foundational for creating change? And what would you say to health professionals that are interested in getting more involved with a group?
Well, I think the answer to that question just came from Alister's answer to the previous question, which is, what is more powerful than the stories he just brought to life right here? What is going to register more with a policymaker or with, you know, a city official, or it doesn't matter. Those stories which are true, and bringing that health story into our democracy as citizens, you know, is just incredibly powerful. Yale says that health will literally make or break the efforts of addressing the climate crisis. You know, I wrote something here, but I think what Alister says just brings it all into place. You know, one aspect of our work that has become so obvious to me is that as health professionals, we can elevate the voice of those on the front lines of fossil fuel pollution. And working in this space, it's really brought to life the profound health disparities that exist in Michigan and our country at large. But in all candor, our volunteer ranks lacks diversity. And so we're working hard to broaden our coalition and to be that, so it's more reflective of those we serve. And we're also trying to learn. We're trying to essentially go on a listening tour with other organizations who have already worked in this sphere so that we can really understand what it is that that the people living in this reality see as their best solutions to their problems, and then elevate their voices. And so I think that's what we in health really have an ability to do. Now, you asked me at the very end, what would I tell health professionals who are considering getting involved? Well, I would tell you that we need each of you. We need your energy, we need your compassion, and we need your critical thinking and your stubborn optimism. You know, I think Brandon had said earlier, it's really hard because a lot of us are really busy, and it's hard, even though we might be passionate about it, to find time. But you know, those of us who have more time are really happy to try to accommodate that so that we can get your voices out and your stories out. What I think is most remarkable about health professionals, though, is their perseverance. Health professionals just do not give up. So I'm really honored and humbled to have this opportunity to work with each of you. And I hope you guys stick around for the breakout sessions. What we're going to do now is we're going to break out according to our states. So I think what you can do, you should be able to see an invitation to join. If you have the latest Zoom, you can actually pick your state and go right into that breakout room, and we'll talk about the clinicians or health professionals from that state. And if you're not from any of the 5 that are highlighted here, we have somebody who's available to meet with you as well. And so everybody's welcome to stick around and just do some brainstorming. Thank you guys so much for being here. Thanks to the panelists for just great answers. And thanks to Dr. Patz for his overview. And Abby, great moderation. See you guys in the breakout room, and see you guys next Tuesday, about a month from now.